Hi, I'm Dr. Roadhouse, and I want to introduce you to our patient, Shirley. Shirley just started in our thyroid program. So, Shirley, why don't you just kind of share your story on, where you've been in when you first started having thyroid problems, and how you got to us, and what we've done.
Well, approximately 37 years ago, I had my thyroid out because my hands were numb, my feet were numb. I burned my hands in a high temperature lab, and they immediately sent me to the emergency room, and have been on synthetic thyroid since then. One of the interesting things I found since I've been coming here is that Hashimoto's, which is what I had, has lots of problems with it, and I thought that that was just a result of having the thyroid cancer. So I came here because of the interesting TV, or not TV, but the internet information that you provided, which is more than I've gotten from the doctors that I've seen, and I've seen numerous doctors. My thyroid, synthetic thyroid's been dropped down, and my hands are numb and feet are numb again, but I'm interested in obtaining my balance again, feeling better. I'm up to, they were going by the TSH, which is all the medical doctors seem to go by. They've lowered my thyroid from 300 micrograms down to, now I'm at 122 micrograms, and I have the same symptoms I had when I was, when I had the thyroid cancer and had the scans done. So I just want to feel better again, not sleep as long as I am, have better balance. I've got a real balance problem, which I'm concerned about, and concentration, memory is a problem at 70, almost 78 years of age.
And what about the stomach stuff? And
Oh, yeah, I had a partial bowel blockage in April, almost a year ago, and I know I have digestive problems. I know I have food allergies. I'm really interested in what we're going to find out on the lab testing.
Okay. Well, so you have a very unusual case.
I'm unusual.
Well, I mean, just to start out with it, okay? So Shirley told you that she had thyroid cancer when she was around 39 years old. What she didn't tell you was that when she was a young child, adolescent, 13 years old, that she had acne. And at the time, I don't know whose idea this was.
The local doctor treated a number of friends.
Okay, so a local doctor treated a number of her friends. So your mom took you there, and he treated her acne with x-ray. Put it on there, and you're a lab tech now. You know that's crazy. But back there 13, and other people were doing that. You could feel it on your face. Your face actually got...
And the smell. You could smell it.
Tissue burning.
No, it was more than that. It was whatever's in the air when the x-ray's going on, because they used really high voltage or whatever it is back then.
Yeah. Well, and back then, I mean, when they did this, we put them inside cassettes that block the radiation, and they weren't doing it. They just did it right in the face. So anyway, she started having a lot of these symptoms, and she was working in this high temperature lab, and she burned her hands because she couldn't feel things. So anyway, they went in, had her checked and everything, and then she had thyroid cancer, and it was from doing the x-ray treatment for acne.
That was Friday, and I had surgery on Monday.
Yeah. So right away they found out, that, and they got in there. So, they removed her thyroid. Well, the thyroid is a complex organ, and it's very hard to get to, and they usually don't ever get rid of all the cells, but they got rid of all the cancer cells and some of the other healthy cells. But when you have Hashimoto's, if you have any thyroid cells at all, and then there are things that activate the autoimmune attack. So if you have like 200 cells, and they're going to attack those 200 cells that are left over. So since then, you've just been suffering with all these symptoms, and they've tried to put you on the synthetic hormone, and they've tried, changing the dosages, and then when they get your TSH back in the normal range, and they go, oh, everything's good, yet you still feel terrible.
Well, that's all they look at.
Right, and that's what, Hashimoto's, if your primary hypothyroid, and there are some Hashimoto's patients that have to get some synthetic medication, but if you've been on synthetic medication and it doesn't change your symptoms at all, then there's a lot more to it, and as you've found out. So we're going to watch Shirley. She just started with us, and we've already done some neurological treatments because we're waiting for all the labs to come back. So, you worked in a high temperature lab, and you've been doing a lot of investigating as far as thyroid, but all the labs that we've used, like, you've never heard of those before, and most doctors don't know about those. And that's how it's different. Those labs are going to tell us what we need to do to fix you. So we're waiting to get her labs back. In the meantime, she's coming in, we're putting her on oxygen, and we're doing the treatment because, as she said, her cerebellum was off and other things were. So we did like a tuning fork, and you remember that. We did a tuning fork on him, same stimulus, and she couldn't feel on this side. So we got her on oxygen, and we've been stimulating her cerebellum, and then today, you felt it. So
felt it really good.
Yeah, so we're already making neurological changes, and then we're waiting until we get the labs back and do the rest of it. So anyway, this is just a beginning where you're at. So if you could name 5 things that you want to get better from this treatment, what would they be? And they don't have to necessarily be in order.
Okay. Memory.
Okay.
Concentration. Balance. Walking without a walker.
Right.
Right now, I'm afraid I'm going to fall because it wouldn't take much to throw me off balance. Like to feel warm again. Because when 4 o'clock hits, I get really, really cold.
4 o'clock in the afternoon?
Afternoon,
Yeah. Okay.
And I'm sleeping way too much. There's a lot I'd like to get done that I'm not doing, which I could do with 8 hours of sleep instead of 10.
Yeah, so energy levels off. And
Oh, absolutely.
Yeah. Okay. All right. So we're going to follow her, and we'll do a follow-up video in just a little bit, and excited to see the results that you're going to get.
Thank you so much.
Sure.